Hi everyone, my name's Will Harlow and I'm the sciatica specialist physio behind Overcome Sciatica. In this series I'm going to be answering some of your questions about sciatica to help you get better even quicker. Today's question came from a lady called Sue who asked, what position is the best position to sleep in when I have sciatica to avoid making my pain worse? Well, the answer to this question is it depends. But let me dive into it further rather than just give you that blanket answer. We're going to talk about, first of all, what makes your sciatica worse and then what makes it better, and then we can decide your best position. There is one rule of thumb though, and that is that everyone should sleep in a position that takes the tension off the sciatic nerve. Let me explain how to do that now. The easiest way to take the tension off the sciatic nerve is to just bend the knees to some degree. This means that if you sleep on your back, it's likely that your knees are flat, that your legs are flat out in front of you, and that tends to be quite a bad position for sciatica. The best thing you can do from this position is to get a pillow or a rolled up towel and put it underneath your knees so they're bent up like that. So you just break the knees slightly while still remaining comfortable. This immediately takes pressure off the nerve and can reduce some of the symptoms of sciatica at night. Another way you can sleep with pressure off the sciatic nerve is by turning onto your side and then bending the knees up, so you're almost in like a fetal position. That should help to take some of the pressure off the nerve. The second part of the answer to this question depends on what aggravates your sciatica. If you don't like bending forward because that sets off your sciatica in your leg, it's probably unlikely that you're going to like sleeping on your side with your knees bent up. Because if you think about it, if you're on your side and your knees are bent, that's actually pulling you into this forward bend position as well. So you need to do what you can to avoid that position. So if that's you, you might be better off sleeping flat on your back with the pillow under your knees, as we discussed before. If you don't mind bending forward, but you hate walking and you hate standing still or being upright, but your pain tends to go away when you sit down or you bend forward, then it's quite likely that lying flat on your back with, even with a slight bend in the knees with a pillow, is probably still going to aggravate your symptoms. So if this is you, you might be better off sleeping on your side with your knees bent up and a pillow between your legs. Pillow placement is really important for people with sciatica, and you can actually get a significant reduction in your symptoms just by using a pillow to pad yourself out. You might want to try lying on your side, pillow between the legs, and then one at the back just to provide a little bit of lower back support. Or you might want to have a pillow between the legs and hug a pillow in front, which will take you slightly forward more into flexion. And if you like to bend forward and that feels nice when you do that, then that's probably the best position for you to be in. There's a couple more things you can do to sleep better when you have sciatica. Some of those things include making yourself nice and cool in the back before you go to bed. So quite often people will find benefit from using an ice pack wrapped in a towel just to cool the lower back off before they get into bed. Some people even find that putting it over their shoulders, which cools your entire core temperature down, helps them get off to sleep quicker, stay asleep longer, and sleep with less pain. That's all I've got for you today about sleeping positions for relieving sciatica. Remember to subscribe to this video and leave a comment below if you found the tips helpful. Thanks for watching, and I look forward to seeing you on the next video.